Phil Nickinson. I am 46 years old, almost 47, and I work here at Community Health Northwest Florida. So my men's health journey started, 10, 15 years ago. Turns out I have high blood pressure, which I discovered when I went to the eye doctor, actually. They were checking things, and they said, yeah, it's pretty high, which now that I think about it isn't surprising. Wasn't living the healthiest lifestyle, had a high stress job. So I did what I hadn't done since I was probably, a kid. Started going to the doctor, and I went in and just said, yeah, I need to, I think, at least get high blood pressure checked out. And they said, yeah, it's really high, and got me on medicine that day. And that was kind of the start of it. And ever since then, I've been, first, taking a pill every day to keep that in check. And second, I go to the doctor every 6 months because we want to make sure that the blood pressure is under control. And that's one of the easiest and I think simplest things to take care of, right? Just keep an eye on it. If you're doing unhealthy stuff, try to stop doing the unhealthy stuff. But really, I'm going to the doctor twice a year just to keep an eye on that. So that's thing number one. Thing number two is I don't yet have prostate cancer, but it would not surprise me at some point if I get it in my lifetime, should I live long enough. And that's because I have a family history of it. My father had it, my grandfather had it, probably goes back farther than that for all I know. So I'm getting checked now. I started when I was 44 years old, I think, because of that family history. Starts with the PSA score, right? That's just a simple blood test, just like they draw blood any other time. And you get a little number for that, and you keep an eye on that number. And if that number starts going up, then you're absolutely, almost certainly, gonna start taking a closer look. And we all know what that closer look means. You've heard it from the other guys. Look, it's nobody's idea of a good time, but it's really just 30 seconds of uncomfortableness for 6 months or a year or whatever of assuredness, knowing that, okay, either something's going on and we need to take care of it, or you're good to go and there's nothing to worry about till next time. And for me, that's the name of the game. I go to the doctor twice a year. And the hardest part was really just taking those first steps into the door and finding a doctor in the first place and saying, this is something I'm gonna start doing for myself. You heard Dr. Smith talk about maintenance, and I really think that's true. This is me doing maintenance on myself. Is the car perfect? No, it's not, but it's running a lot better than it used to, for sure. And look, we talked about masculinity before. For me, there's really nothing more manly you can do than take care of yourself so you can take care of the people around you. That's really what it's all about, right? So for me, it's that simple. Get a doctor, ask questions. I guarantee you with 100% surety, you almost certainly, probably, don't have anything they haven't seen before. They've seen it all, they've heard it all. They're doctors. Ask questions, they're gonna have answers, and if they don't, they're gonna find people who do. So it's that simple. Whatever you need to get checked, get it checked. Whatever you need to take care of, get it taken care of, and be around for everybody in the years to come. If you need to eat better, try to eat a little better. If you need to take some medicine, take some medicine. And if your wife says you need to listen to the doctor, do what your wife says. Trust me, you'll be better off for it.